Hi, I'm Ruth Pavelchek. I'm a volunteer at the Crab Orchard Care Center working with the mobile medical clinic. This is the first step in the process of taking in patients. We register at this table and help people understand what services we provide and help them with the registration forms. After the registration process, the clients come to this table where the registration information is inputted into the computer. That's station number 2. This is station number 3, where the medical history is inputted into the computer, and from there we go to the triage. This is the triage center where the patients are weighed, given blood pressure tests and other tests, and determine what exactly the help is that we can provide for them today. After the triage, they will be entered into the medical vehicle for consultation with the doctor.
After patients have completed the triage station, we bring them on board the medical clinic. We have an office nurse who will then do her evaluation of why they're here to see us and kind of review what we've already found out about them. And then I come in and see them as a physician. This is one of our exam rooms. This is our also being set up to be a procedure room. So we have a mobility an adjustable bed here, exam bed that goes up and down, particularly for patients with low mobility. We also have a wheelchair lift that comes into this exam room, so if patients have trouble climbing the stairs, they can come in through this, even if they aren't in a wheelchair. We also are collecting supplies to be able to do some minor procedures, skin lumps, bumps, and removals, things like that, minor suturing. So this is one of our typical exam rooms. We also have some patient education materials on the wall, but our main focus after after they finish with me is going to be patient education, and we have a whole separate station that addresses that. After the patients are finished with seeing the physician, they come out here to the main area. We have 2 stations here. We have a patient education station and one person who's devoted completely to patient education. They review their medications, their diagnoses, give them any particular teaching that they need for their situation, with the thought that if we can empower patients with some knowledge about their condition and disease states, that gives them some additional ways to address their medical conditions without necessarily having to use all medications. We do have a limited supply of medications on board to give away. We do have a lab station, and that's this area over here is for drawing labs. LabCorp has agreed to run our labs for us at a very significant discount, and so we do have that ability as well. After they are done here, this is their final stop, and then we schedule them a return appointment if they need to come back. Otherwise, they exit the mobile clinic, and we're able to maintain one-way flow, so patients come in through the practice site, come out to the mobile clinic, and then leave from here. This is our other exam room. It's our front exam room. It does not have the adjustable bed. It's a fixed height exam table. We also do have an attic on board, and the attic is where our electronic health record server is stored. Because we can't assure ourselves that we will always have access to the cloud wherever we go, we've decided to bring our server with us so that we will always have access to our patient data. So that's the main function of the attic right now, is storage and then electronic health record server.